As been introduced, I'm Edson Muhwezi from UNFPA. And as you may be aware, we have one of the fastest growing populations in the world, and at 3%. And though some good news because we are fertile, but it's also a recipe for disaster. Because when you consider our resources, when you consider our country, Uganda, which is going to be like 100 million by 2050, I don't think we have that carrying capacity, especially within our setting where 80% are in the rural areas, depending on tilling the soil, not in urban centers like industrialized countries. So we must have better ways of population management. And if we don't wake up now, time will tell, and history will tell that we are here to blame. So we must act now. And you cannot improve even the household income that we are talking about without addressing of high dependency rate. So the moment you have 10 children, you cannot do that. Even if you get funds, you will not be able to increase your household income. And know there is a linkage between household income and the health of the family. So we must invest in family planning. Whether we want it or not, we must invest in family planning. That's how we shall harness the demographic dividend. We must invest in education. And we must invest in health. And we must invest in employment. Otherwise, even if they are studied, they have gone to school, but they are not employed, then they are not productive and they are not earning income. So we must harness the demographic dividend through those areas. First, have a demographic structure where there is less dependence rate, where you have a youth, where you have a bulge in the middle, where you have more people productive. And as you may know, countries like Japan, they worked on all other things. But not until in the late 50s, when they worked on the fertility rates, that's when there was a leap in their economic progress. And all these countries. So let us address this comprehensively. And as development partners, we are ready to support the government. We are here as facilitators. But the government is there to provide leadership and own whatever is being done. Indeed, we are providing most of the funding for health, and we are providing technical support and other things. But we depend on the government. And as we said, we have talked and talked. We have written documents and documents. But are we walking the talk? I can see here my lecturers, my professors, like Professor Kanyesi, they talked about universal health coverage like 20 years ago, all through. But how come that we are not walking the talk? How come that we are having workshops and documents and documents, roadmaps and strategies, and we are not walking the talk? Therefore, we must have structures. And I appreciate Dr. Sarah Biachika. We must have structures. We must have structures that function. Not just structures, but a facilitated function. And you know, they say the fish rots from the top. We must start from the top. Who has the jurisdiction of bringing all sectors together, plan together, hold them accountable, monitor together, review together, evaluate together. It is common sense that health is socially determined. And we know that. Even the primary school children know that these are social determinants of health. That health is only, the health sector is only at the tail end for repair. As Professor Omaswa used to tell us, actually even on radio, that health is made at home but only repaired in hospitals when he was a Director General at the Ministry of Health. So it is kind of common sense. But we must make things work. And that is what is of concern for development partners. We are talking, we are writing documents, but we are not moving forward. So we must have structures. And we must have structures at all levels. We must start with the Prime Minister's office. When you look at the design of the Prime Minister's office, is it designed, where is the design to bring health sectors together with the Minister of Health providing technical direction and having roles and responsibilities for each sector and holding them accountable like on a quarterly basis? We want the leadership, and that's what we want, leadership to make things work. And we are talking about, also we want systems. And we don't need to reinvent any systems. We don't need to have parallel systems. We have systems. And each sector with regard to health, they are doing everything possible. Ministry of Health, they are doing everything possible. But who is going to tie the strings together? That's what we are lacking. Who is going to tie the strings together? I was working in a mission hospital, in Ikisi's hospital. But we put up a very beautiful hospital. But you find there's no power. When our dam, we had a small dam, had electric power. But we don't have power. People cannot access the hospital because roads are very bad. You don't have water. Who is bringing people together to plan and be held accountable? That's what we are lacking. So we are lacking leadership. And there must be structures at the national, at the district, at the sub-county, at the parish, at the LC1 level. And those structures, which are multi-sector in nature, must be interconnected. They must speak to each other. We will want a country that is focused, that is not spreading out thin, bearing in mind the realities on the ground. Because we are a poor country, people don't want to say we are poor. We say we are resource constrained anyway, resource limited. But we are a poor country which spends only $53 per capita expenditure on health. Other countries spend $5,000 US like the US. So we are a poor country, so we cannot afford to be extravagant. What we must do is we are working hard, but Ugandans, with due respect, we must work smart. We have 75% of the diseases preventable. We have 80% of the population in the rural areas. But you look at our investment. Is it appropriate? Or it's disjointed? So we must, as the late Julius Kambarage Nyerere used to say, it's a kupanga ni kuchagua. We must prioritize on high impact interventions. Otherwise, if you don't have community structures, how will you prevent all these diseases? Otherwise, you can start community structures and then you run, we need some specialized services. You are running up and down and you are spreading out thin, lacking the focus. Have like 3 priorities. We shall have community structures for prevention. We shall have multi-sector engagement to make sure health is mainstreamed in every sector. Then as a country, we can leap forward. Then other things can wait. So thank you so much, but we need to prioritize and we need to be focused. Wow. I thank you.